Okay, so circulation of the lower extremities. Okay, so the legs. Okay. Now, for you to appreciate what's going on, I have to explain to you that before we get into this, that our legs in utero, about 5 weeks of gestation, after fertilization, our legs flipped around. Now, that's not on my list that I'm gonna go up there and complain about because it makes sense why it does that. So let me prove to you that our legs flipped around 2 ways, and then I'll explain to you the reason why they flipped around. Okay? And then we'll go into the anatomy here, which kind of makes sense after you understand this concept. First off, my lower legs, they flipped, well, the legs themselves flipped around. I'll show you. If I want to flex my forearms, are they going into the audience or away from the audience? Into the audience, right? I'm flexing it that way. If I flex my lower legs, are they going into the audience or away from the audience? Away. Something happened here. Does that make sense? The other way you can look at it is, in the anatomical position, my thumbs are lateral or medial? Lateral. The corresponding digit in our feet is the great toe. Is the great toe medial or lateral? Medial. Something flipped around. Does that make sense? Okay? Now, here's the significance of it. We're humans, and humans are one of the things that we're more advanced than others, and there's a lot of things with the opposable thumb, and we got other things, but one thing is that we could walk upright. We could walk and move from one place to the other, and yet we can still use our hands to do things. That makes us more advanced, right? Monkeys and gorillas have to knuckle walk, so to say, okay? But we could stand up for all our time. So look what's going to happen here. Keep us upright. If I need to make one step forward, I'm going to exaggerate so you can see it. I'm taking one step over here. What happens to my lower leg on my other leg? It flexes, doesn't it? Okay? It has to flex. The only way that we could stand up straight is that we have to keep our center of gravity perpendicular with the floor. So our torso has to be perpendicular with the floor. In order to do that, we got to create not a tripod, we've got to make sure that we can do this. If our legs, so you could appreciate it, if our legs bent the other way, like a flamingo, okay, then look at what happens to my center of gravity. I'm going to be bending it this way. That means my center of gravity, I have to be hunched over because now all the weight has to be where the bent legs are. Does that make sense? So our legs flipped around for that purpose, to create us so that we are upright. We clear with that? Okay? So, with that said, the arteries have flipped around a little bit when we get down here. And that's where I want to show you. Okay? All right. So, circulation of the legs. Again, the diaphragm's up here. Here's where the bifurcation is at the belly button. All of this is our scarecrow, right, or abdominal cavity, abdominal arteries. What we're talking about now is the right common iliac splitting up in the external and internal. So, again, these are arteries, and I'll show you veins. If you know the upper extremity, the lower extremity is going to be very similar with a couple other caveats here, a couple other situations that are different, like pretty much the same. Okay? Again, I'm going to abbreviate just to speed up time and not make this so messy. On your exams, on everything, you wouldn't abbreviate. except for A for artery, D for vein, L for left, R for right. Okay. What is this big one over here? The abdominal aorta, right? That's going to split into two things. What is that? The common iliac. Be careful of iliac. There's one L in iliac. Okay? There's going to be one that branches and it goes into the pelvic cavity. What is this one? The internal iliac artery. Okay? What is this one? External iliac artery. Okay? This over here, the squiggly thing, I put it here just really fast, but that's the median sacral. That gives blood supply to the sacral area. All right, now, the external iliac changes its, just the way we saw in the upper extremity, same road, just changes its name when it gets to certain landmarks. And I'll show you where those landmarks are. The external iliac becomes something called the femoral artery. Then, at the knee level, it becomes the popliteal artery. Now, the area where the external iliac becomes the femoral is a ligament that happens in the groin area called the inguinal ligament. You'll learn about that when you get to the reproductive system. On the model over here, this is the external iliac. Here's the, and you'll see when you come closer, this is the inguinal ligament. Then it comes out as the femoral over here. So the inguinal ligament is where the landmark is, where the external iliac and the femoral artery are. The knee is going to be where the popliteal begins. Okay, the knee area. Now, now the popliteal artery branches off into two things. But remember how I said your legs twisted? In the arteries, they only twisted 90 degrees, not 180. Veins did something else, though. So what's happening here, like you saw in the arm, you have, let's say, the ulna and you have the radial. What happens here is that it kind of flips 90 degrees. So that one actually comes out of the board and one goes into the board. Can you visualize that? So this is going, so the one that's coming out of the board is going to be something, it's going to be anterior something. It's coming out, it's going anterior. It's going on the, going where the tibia is. So this is going to be the anterior tibial artery. The one going backwards is going to be the posterior tibial artery. Off the anterior tibial artery, it comes, it continues above the, or on top of the foot to the great toe. That little area there is called the dorsalis pedis artery. And then you have off the posterior tibial, remember the posterior tibial goes backwards, there's one that comes off it going lateral. and that's called the fibular or the common peroneal. Now I just want to make sure, and I always get a handful of students doing this, there is an anterior tibial, a posterior tibial, and a fibular. There is no such thing, I get this all the time, tibular. Similarly, fibula. All right? I don't know which one you're talking about. Does that make sense? So unfortunately, if I see that, I can't even give you half credit because I don't know which one you're talking about. You made a hybrid. Does that make sense? That's where one letter difference makes a whole big difference. And I go through this and I still get 5%, 5 or 10% of students still doing that. So now it's recorded, now I've said it, just make sure you don't, that to me is just a careless thing. You probably know what you're talking about, but I can't tell that. All right? Explaining something like that, say there's a blood clot in the tibular artery. Do you see where that's going to cause problems to explain it to another medical professional later on? Okay? All right. That's it. That's the arteries of the lower extremity. Okay? External iliac turns into the femoral artery, turns into the popliteal. That splits into two. Anterior tibular, I kind of did it the other way, but anterior tibular and a posterior tibular. There's a branch that comes off the posterior tibular, that's your fibula. The anterior tibular gives blood supply to the dorsalis pedis. And then you got the digital arteries like you've had in the fingers. All right? Questions about that? That's the easy one. Okay? And this is showing the same thing. But now, let's do the venous system of the legs. Like I explained to you before, we have more veins than we do arteries. So we don't just have deep veins, we also have superficial. But it's not as complex. Well, we only got 2 extra veins in the leg that we should be concerned about. In the arm, there was 3. So we're going to just do this whole thing again. All right? Okay. So this is going to be our great toe, in case you didn't see. It's called the great toe. All right. That's it. At least for the deep veins. Looks very, very similar. Okay? Now, I'm going to label, like I did with the upper extremity, I'm going to label the veins in the opposite direction of what the blood flow is. Remember, the blood flow here is going this way. The blood flow for the veins are going that way. Does that make sense? But I'm going to label it backward just because I conditioned you to look at it this way. All right. What do you think this blood vessel is up here? Big one. Inferior vena cava. Good. All right? And that branches off into 2. What is this? That's the common iliac. but these are veins now, right? Pelvic cavity is going to drain, or the pelvic cavity is going to be drained of deoxygenated blood, and it's going to go into, what is this? The internal iliac vein, right? There's one here too. What do you think this is? External. Yeah, this is pretty easy now. External iliac. Changes its name to what? Femoral. Changes its name to what? Popliteal. And then you have one that comes out of the board. That's going to be our anterior tibial. That leads to our dorsalis pedis. Again, these are all veins. And then one going back into the board, this is going to be our posterior tibial vein. And there's a branch that comes off of that one, or not really comes off, it goes to, right? And that's going to be our, what? Fibula. Okay? So those are our deep veins that follow the arteries. Remember arteries, how I explained to you, arteries are always going to be found deep. You do not want to have your arteries superficial. You cut yourself, you get in a motor vehicle accident, and you got an artery that's close to your skin, you're going to shoot blood out that way. You want to have it protected. Things that we've been talking about throughout A&P 1 and 2, that function reflects structure. Physiology reflects anatomy. It makes sense to put arteries that are more vital to you deep within the muscle bed, right? Into the muscles. So these are deep veins that follow well, I wouldn't say deep arteries. There's only one set of arteries. But then we have superficial veins. There's only two to worry about. Like we saw with the arm, we have the cephalic and we have the basilic. And then you have one that connected to two. You don't have to worry about a connection, at least with the legs. Do you remember cephalic versus basilic? Which one was the longer one? Cephalic. Was that lateral or medial? Lateral. Remember how I said your legs flipped around? So now the long superficial vein in the leg is going to be medial. And we have this one that comes from the ankle of the leg going up this way, and it goes really, really long, and it dumps into the femoral vein. We call this the long saphenous vein. We don't have saphenous arteries. It's also noted as the great saphenous, so there's a few names. Then we have one coming from the lateral aspect of your ankle, and it's a shorter one. It goes this way and dumps into the popliteal. Can you guess what that's called? Yeah, all right. So this is the short, or I've seen lesser, saphenous vein. You ever hear someone having a DVT, a deep vein thrombosis? Would that be a thrombus or a clot in the long saphenous vein? Short saphenous? Those are superficial veins. I never heard of an SVT. It's called a DVT. So it's a venous thrombus or a venous clot in the deep veins. It's usually in the popliteal or the posterior tibular, usually more common ones. But that's what they're talking about, deep vein thrombosis. Okay? So that's it. So here's the venous systems as a quick review. There's 5 systems. We went through them all: superior vena cava, inferior vena cava, coronary sinus, azygous, portal venous system. We didn't go into depth with coronary sinus system and the zygus, but you know about them. So here's the superior vena cava. You got the arms that are going to drain into there. Okay? We have the inferior vena cava that's going to really drain the lower extremities and the abdominal cavity. We have the coronary sinus that's going to drain the heart muscle. We have the zygous system that's going to give, that's going to drain the chest specifically. And then I talked about the hepatic portal system. That one's going to not just drain, let's say, certain organs like the intestines and the spleen, but it's going to carry the nutrients to get to the liver. So those are just summaries about this venous systems. And I also put a couple pictures here to help you along with trace, to give you some idea with things. This is the arteries. They're not all the arteries. It just gives you a quick overview of what's happening here. Like the brachiocephalic, you go to the right common carotid and the right subclavian, and you got a few things here. This is not even going into the circle wills, but it gives you some idea. Here's the celiac, and here's 3 branches coming off it. You can look at that. And I did something similar with the veins. So you have here the hepatic portal. No, I'm sorry. The hepatic portal system's over here. You can see the splenic vein. You have the inferior mesenteric vein going into the splenic vein. The splenic vein and superior mesenteric vein turn into the hepatic portal vein, into the liver, into the hepatic veins, and so forth. So this is a nice overview to put things together. Any questions about the blood vessels? That's really all the blood vessels that I want you guys to know for your future practical exams. Okay, I wouldn't worry so much about trace questions just yet.